Through the Oregon Health Plan, over 1.5 million people in this state have had access to medical care over the last 2 decades. But setting priorities and making a better use of limited resources does not in itself reduce the escalating cost of medical care, which is growing faster than wages, which is a huge burden on our business community, and which is eroding our ability to invest in education and other social priorities. The fact is that our current healthcare system is simply not sustainable. And that became very, very clear earlier this year when the one-time money that had propped up our healthcare system in the last biennium disappeared, revealing a 40% discrepancy between the available revenue and the cost of those services. Now, most states facing the same kind of situation have responded by simply throwing people under the bus, by simply dropping people from coverage. Like we did 20 years ago, this state has chosen another path, trying to keep people covered, but trying to, at the same time, reduce the cost of medical care itself. Because we believe there is nothing to gain and much to lose by simply dropping people from coverage and forcing them into the emergency room, where we end up paying for the cost of their stroke in the hospital rather than managing their blood pressure in the community. Today, we're embarking on another bold journey to change the nature of our health insurance market and to change the way health care is organized and delivered in this state to improve the health of our people and do it at a lower cost. Under this new system, your doctor, your dentist, your nutritionist, your physical therapist, your mental health care provider, your community health worker will all work on the same team in a local community coordinated care organization. And they will focus on keeping people healthy rather than simply waiting until they become sick. These organizations will operate on a fixed global budget, and they will focus on patients like Kay, trying to keep her healthy, trying to keep her out of the hospital, trying to keep her engaged and involved in the community. This is going to require an unprecedented level of cooperation and collaboration and trust between providers and consumers and payers and insurers. But we have the opportunity today to do something that no other state has done, something that has eluded our nation for decades, producing a healthcare system that actually produces health, that improves the health of our population at a cost we can afford. This is not going to be easy. We all know that. But I know that we can do it because we've done it before. Oregonians are counting on us, and we are not going to let them down. As George Bernard Shaw once said, some men see things as they are and ask why. Others dream things that never were and ask why not. Why not us? Why not now? Why not here in Oregon?